Thank you for that very kind introduction. And yes, thank you, Dr. Duxbury, for a fantastic presentation. And it was kind of interesting that you sort of left on the note of ensuring that we have the right evidence to support change. And that's sort of the continuing theme from my presentation. So again, the title of my presentation is Community Engaged Research, Developing Evidence to Support Practice. And I hope from my presentation that you'll see how my research program at least engages different employer groups to support change within the practice of ergonomics. So let me just see if I can get my slides to move here. Great. Okay, so yeah, so when I think about the work that I do, my work is largely informed by my clinical practice as an ergonomist and kinesiologist. So I worked in that field for about 15 years before I went back to complete a PhD and do research in this wonderful area of occupational health, wellness, and ergonomics. And so when I start thinking about what that practice area looks like and what that research looks like, I'm sure any of you and all of you that collaborate with researchers can sort of identify and recognize that it is a complex process. So as employers, a lot of employers are looking and seeking to create healthy work environments for their workers, but largely, sort of grasping at, how do we do that effectively, and what does the evidence say, and how do we build that relevant to my space? And certainly when I worked in disability management, I heard a lot of that, like, yeah, sure, that works there, but will it work here? Particularly when we looked at, different employers across the country. So really my work is aiming to do that, is to, consider the legal, administrative, and cultural influences of work health. There's a lot of different factors that impact the way that we develop policy to create a healthy work environment. There's often organizational barriers to change, so working with management and working with unions to ensure those changes can actually happen. And then at an employee level, so how do we engage employees in that process as well? And we certainly do that from an ergonomics and intervention perspective when we're practicing, but how do we do that as researchers? So when we're actually trying to implement and design and implement evidence-based solutions, how do we do that? Because at the end of the day, the recommendation is really about including all stakeholders in that research process. So these are just a couple of pictures from some of the, collaborations that I currently hold. So here's the group that I work with up here in Thunder Bay. So I do a lot of work with firefighters and first responders. A lot of my work has been aimed towards fire, particularly over the last few years. So this is a picture of some of the firefighters that I work with. This is the Chief Hankio, who supports my work, Union President Dennis Breskison, and then my primary knowledge user is firefighter Regan Bolduc. And then you see this is some picture, same kind of networking from Hamilton. This group has changed, but Rob continues to be our primary knowledge user. And then this is some work that I've done directly with CROSH. And so you can see some of the previous CROSH members with a local mine up here. So we work very collaboratively and very closely together as a team to identify the problem and to support developing evidence to solve that problem. So this is just an example of how I do that, and how a lot of researchers, particularly, you'll see that within the CROSH model as well, that we do this sort of collaborative-based approach. So here you can see, this is just an example from Thunder Bay Fire Rescue. So obviously we have to engage with the union, and the union is a very strong supporter of a lot of the work that we do, and then having the management as well, and then firefighters within that space. So how do we sort of bridge that piece between, what their needs are, where they want to go, recruitment, implementation of results, and then with me, and I'm over here sort of as the university and my students and my team, how do we bridge that piece? And we use what I refer to as a primary knowledge user. So regardless of the network that I'm developing with my research partner, we always have someone that we sort of designate within the organization that we call a primary knowledge user. And really at the end of the day, research, designing, implementing research for employers is really dependent on having a strong primary knowledge user. And I've been really fortunate, particularly in this partnership, to work with firefighter Bolduc, and he's provided a really important lens to the work, helps with analyzing data, creating and understanding the problem, and helping develop solutions for those problems. So just to move forward, how do we do that? And I sort of use a three-phased approach. So one is integrating current literature with the context. So I think understanding where the work lands within the sort of breadth and scope of the scientific literature is really important. And then I'm going to walk through each one of these and how we sort of do each one of these within my team. And then having a really strong collaborative approach, I think, is important. And then pilot data that sort of lends itself to wider projects. So as an example, when we think about, just assessing the temperature of the literature and what's actually happening in science, when we think about this context with respect to fire and what is firefighting, what does that say with respect to work health? And so we know that, particularly with the lens of COVID-19, building on our previous presentation, we know that firefighters are at increased risk for exposure already for transferable diseases, and particularly witnessing traumatic events. So there's integrated sort of risk with respect to physical health as well as mental health. And then we know from the literature as well that COVID-19 pandemic increases risk for adverse impacts on mental health more globally and more widely across all organizational sectors, which we've already heard a really great talk on. And we also know that, that a lot of fire services right across the world, worldwide, have adopted a lot of different strategies. And a lot of them are sort of peer-based, but the effectiveness of those programs is less clear. So firefighting is a really unique context for me to form my work and to form my projects or to form my research program. But, a huge problem that we sort of see is that they've kind of moved forward on with a lot of strategies, but really at the end of the day, how effective are those strategies? So that's sort of where we were starting from as a group. We kind of knew that these were problems. We knew that this was happening in science. But then the next piece was really to understand and work with the team to understand how did that reflect within the context of their organization? So that's fine. That's what the literature says globally. How does that reflect within their space? And what are they actually doing in their own space? So again, this is an example from some of the recent work that we've done with Thunder Bay Fire Rescue. And this is particularly aimed around mental health. So a lot of our work over the last couple of years has been aimed towards developing evidence-based solutions to support firefighter mental health. And we sort of, sat down as a team. So that meant sitting down with the primary knowledge user, with Firefighter Bolduc, as well as the fire chief, as well as union, as well as their joint health and safety committee, different chiefs at different levels, firefighters themselves, and really trying to understand sort of what they were doing now and where some of their concerns were sort of leading to. So what we found, just sort of anecdotally, is that they were using a strong peer-based support approach using debriefings, diffusing, critical incident response teams. So this is what this figure over here is sort of demonstrating this reliance on their critical incident response team and using these sort of, external resources and strategies to support mental health within their service. So informal peer support, diffusing, and of course the EAP program. So there was a less focus on accessing existing resources. So there was some concern whether or not this model was working or whether or not they were sort of jumping ahead and maybe not actually using evidence-based strategies to support firefighter mental health. And then there was a huge concern about sort of this heavy reliance on the critical incident response team. So how much were they bearing in terms of, supporting firefighter mental health, and how was that actually impacting the mental health of the CERT team themselves, and whether or not that was even an effective solution. So that's sort of where we landed. So we knew what the literature was saying around mental health. We knew that there was a problem, and we knew sort of what was happening within the service themselves. But then we needed to sort of say, okay, now how do we actually solve that problem, and what are we going to do? So this obviously doesn't look like mental health research, but we did collect some pilot data. So we were sort of starting from that end. There was some discussion around musculoskeletal health as well, and obviously cardiovascular health is always a prevalent concern within the fire service. So the next step was to start collecting some pilot data. So we knew what the problem was, we knew what the literature said, and now we needed to find out, could we even, collect data to address that problem, and how would data collection actually look? And are we able to do that? So Thunder Bay Fire Rescue, for example, had never ever collected research data before. So we were interested to see if we were able to do that together. And sorry, I'm going to go back a slide here, but even just looking at collecting some kinematic data and sort of questionnaire self-report data. So we did collect some pilot data. This is some results from that pilot data. I'm not going to go through a lot of detail, but this was specifically related to mental health. And we were just looking to understand and sort of have a picture of what their critical incident response exposure looked like. So that's what this data was sort of showing at baseline versus 6 months. And sort of looking at some of the primary factors within the questionnaire that we were looking at that was sort of reflected within this particular sample. So again, this was a pilot study. This data doesn't represent the entire service. But what we did learn was that we were able to collect this data. And what we also learned from collecting this pilot data was that, there was a real problem in terms of exposure. So we know that critical incident exposure can impact mental health, but we just didn't know how, in what way. And we didn't know if this would sort of this relationship or if this data would sort of transition into the wider service itself. So we had an opportunity to apply for some elevated funding. And that's sort of how I think it's really important to work as employers. It's good to have funding to support, students coming in, to support operationalizing the research itself, whether it's, hiring people to help support the project, providing equipment to help collect data. So having that funding is really important to help support that. It's not necessary, but it certainly does help. But regardless of whether or not we were receiving the funding, we were able to sort of move this project forward. And what we decided to do is, okay, we found this problem that there was a high sort of level of critical incident exposure, but we didn't know how it was manifesting it or in injury and or illness. So that was sort of one of the next questions that we had was, okay, we know that this exposure exists. How does it manifest in terms of post-traumatic stress injury risk? And then the question about the critical incident response team came up. How is that sort of impacting the mental health of those responders? And then at the end of the day, this was a really important piece for me and for my team, as well as for the partner was, okay, that's fine. We collect all this data, but how does it transition and how do we translate it into practice? So that was an important fourth objective from the work. So I'm not going to go through a lot of detail on this, but this is just sort of demonstrating that how we sort of approached the mental health component with this particular partner. We collected demographic data. We had a couple of measures that we administered across the entire service, and we collected data over a month. So that's the one nice thing about working with this particular group is they're very quick to supporting our data collection. And we found similar findings across the entire service, which was interesting. It certainly helps to target intervention. So we're using some of this data now to target, mental health wellness programming to target some of these exposures that firefighters within the service are experiencing. And this was an important new contribution to the work. So one of the questions that they had was, okay, that's great. We know that there's exposure, but how does it manifest in terms of illness or injury? So we were able to sort of look at post-traumatic stress injury risk, and we looked at the relationship between that and critical incident exposure as well. And what we found, obviously, was a moderate relationship here. And I'm happy to discuss that data in future presentations if you wish. But right now, I'm just going to sort of focus on how that sort of lent itself to implementing changes in practice. And then this was sort of how we approached identifying. So now we knew what the PTSI risk was, but then how is that sort of implementing, or how is that impacting, the critical incident response team? And so we did that through what we call a qualitative approach. So firefighters actually sat down, there were members of the CERT, and we actually talked to them about, what was it like to be a CERT member? How did it impact, work, family relationships, and found some really important data from that component of the work as well. So these are some of the findings. Again, this is preliminary findings, but what we did find overall was that this critical incident response team approach might not be the most effective model to manage firefighter mental health. So how did that translate into practice? Well, we integrated that with a scoping review as well, just to say, okay, so if that's not working, what other kind of solutions should we be looking at? So we worked together again as a team and conducted what we called a scoping review, and really identified there was a real gap in this particular occupational sector for evidence-based mental health management strategies for firefighters. And that was a really important finding because it actually changed how they moved forward in terms of their mental health management program. So they developed a psychological health and safety committee out of this work. They really started to focus on what does the evidence say about supporting firefighter mental health and how can they actually provide those resources going forward. Continuing to do some informal peer support and obviously continue their EAP benefits. But this approach has been sort of pivotal over the last few months. And another core component and core approach with our work is to ensure that we present and we bring our findings back. So we work really hard as a team, regardless of my partner, to present work, to provide outputs, not only to a fire community, but to the academic sector as well. So just in terms of some key findings, developing a research partnership takes some time to build trust. And I think that's the biggest piece. And I'm really fortunate to have that relationship with Thunder Bay Fire Rescue and Thunder Bay Professional Firefighters Association, as well as with New Gold. And then integrating research with, particularly in this case, firefighter health and safety training ensures approaches are relevant, ready for uptake, and provides new lens to view problems. And I think that's been a really important output from some of our work, is that as they're so close, as our research partners are so closely tied to the work, once they have the findings, they can sort of uptake and make changes really quickly and respond to the problems that they've been having. An effective primary knowledge user is a really important component. In this particular work, we had some really nice soft benefits from this work as well. It's sort of open dialogue around mental health and reducing stigma, and really developed some contextually relevant evidence to support their mental health initiatives. So I just want to acknowledge the people that continue to support this work and my funding support through the Canadian Institutes of Health Research. So I'm going to leave it there if anybody has any questions. But yeah, I think that I'll leave it there on that slide. Thank you.
Thank you, Dr. Sinden, for your amazing presentation. We have a question in the Q&A. It says, for Dr. Sinden, can this research transfer to other first responders like paramedicine or police?
Yeah, that's a really great question. Yeah, I think it can. We're currently doing some work right now with Superior North EMS as well, where we're using a very similar model with that group as well. And we're just in the process actually of writing a big project that's integrating paramedics and fire in particular. So if you're interested and that's a sector you work in, feel free to reach out, and I'd be happy to see if there's a way to include you on that work kind of going forward.
Thank you, Dr. Sinden. We have another question. It says, do you think these findings apply to both workers in Southern and Northern Ontario?
Great question. Yeah, so I think, I'm really proud of the work that we do in Northwestern Ontario. Research in the North for the North, I think, is really important. And I think there is some transferability for sure. I think that the work context that people have in Northwestern Ontario versus Southern Ontario is slightly different. But I think when we do research in a geographically specific area, I think it's important to evaluate it as we transition it into another context. So working with a partner, perhaps in Southern Ontario, to say, what does that program look like? And then how can we contextualize these findings to that particular organizational environment?
Thank you, Dr. Sinden. We have another question here. It says, how important is the creation of the mental health committee in the core section that you mentioned?
Sorry, can you repeat that?
I said, how important is the mental health committee you mentioned in the core part of your presentation?
Yeah, so that's and I know other organizations and other services may be doing that as well. That was something that Firefighter Bullduk and I sort of worked on together, and it was kind of his brainchild, and he's been running with that. I think it's really important. I think it's great that they have a psychological health and safety committee. I think it falls in line with some of the CSA standards as well in terms of managing mental health within the organization. I think it's important to keep that committee dynamic, but I think it's and to really establish a clear role for how it gets operationalized within the service, and then how it gets operationalized within the service. But I think it's a really core component to build that expertise within any sort of first responder community.
Thank you very much. We have another question. It says, could this research apply to mine rescue volunteer responders?
Say that again.
Could this research apply to mine rescue volunteer responders?
Mine rescue responders. Yeah, I think that again, similar to the previous question around other first responder groups, I think you can apply the core principles. The approach itself, absolutely. I think the findings can be extended as well. I just think ensuring. I always say that it's important to contextualize your findings to the environment. So there's ways to do that, and what that means typically is that you look at the results and you sit down as a team and sort of discuss what does seem to reflect your organizational culture, your context. Is the problem the same? So can we actually transition those findings? And if we can, great. And maybe they need to be tweaked a little bit, but absolutely we can, it's important to find ways to do that.
Okay. I think that's all of the questions we have in the Q&A. And I think we got to move to the next presenter. Thank you very much, Dr. Dinson, for your wonderful presentation. Thank you, everyone, for your questions.